Hello and welcome to Inside Indiana Business. I'm Gary Dick. A major $325 million expansion project is planned at Ascension St. Vincent, Indianapolis, on the main campus here on the northwest side of the city. The project includes relocating the Ascension St. Vincent Women's Hospital and a new brain and spine hospital. With more on how the deal came together and the potential impact, pleased to welcome to the show, as always, CEO Jonathan Nalli. And Jonathan, welcome to the program, and congratulations on what is a very big deal.
Gary, thank you so much. Glad to be on the show and be able to talk about such exciting news that we've seen here within our organization as we continue to transform how healthcare is going to continue to be delivered in the future, as well as what we know a more patient-centered type of environment that based on outcomes is going to be.
Well, let's get right to it. I mentioned transformation. I think the transformational is many times overused in the world today, but I think in many respects for St. Vincent Ascension, this truly is a transformational project.
It is. As you know, 86th Street campus has grown up since the mid-'70s in terms of a hospital to serve the new near north side all the way to what is now a tertiary, quaternary trauma teaching transplant facility that serves every county in the state, the contiguous counties to Indiana and other states within the union. And based on that, we worked with our physician partners in neonatology, maternal fetal medicine, neurology, and really our Goodman Campbell brain and spine partners to develop how is it we need to make sure we're treating the sickest of patients from Indiana and beyond with this project.
Let's talk about some of the specifics. Relocation of Ascension St. V's Women's Hospital, 109 new private rooms, new brain and spine hospital, infrastructure, parking garage. Talk about the elements of the project and what they mean, why you settled on these things to pursue.
Absolutely. Let me begin with the transformation of the campus. And over the last 7 years, we've worked to revamp and revise the campus. We've worked to take down unnecessary buildings, create green space, sell other buildings that were unused into public-private partnership for the senior population, convert the Martin House to the William K. Nasser, MD Education Healthcare Simulation Center, and now, in addition to an oncology project that's wrapping up and a surgical services project wrapping up, we felt it was need to continue our commitment to the state of Indiana with the perinatal levels of care announcement that occurred with the governor signing that bill at Peyton Manning Children's Hospital to advance and relocate our women's and NICU hospital next to Peyton Manning Children's Hospital and connected to 86th Street Hospital as well. We are advancing not only the level of service, but truly elevating what type of service those sick moms and those babies get on an annual basis. We see almost 1,000 transfers a year into that facility, and it's how we wrap those services together will provide even greater outcomes to the incredible outcomes seen at what is the state's largest neonatal intensive care unit. In addition to it, we felt it was necessary to convert parking structures to the facility to make sure that we added different surface lots. Some patients like valet, some patients like parking structures, some like surface parking. And then we're also going to raise the existing parking deck, add a new one in its place, and build on to accommodate the growth that we've seen in this critical care population in the last several years.
Yeah, Jonathan, I know this has been about 2 years or so in the making. You touched on this earlier, but talk about in the planning process how you look to this project to address really the future of healthcare when it comes to delivery, patient delivery and services, and also the cost of healthcare, which obviously continues to be a big issue.
Absolutely, Gary. We're so mindful of where the cost of healthcare is going, and we work constantly to make sure that the value we provide to our patients and the community as whole allows us to establish a direct connect to those outcomes, because patients are becoming more centered on what does that overall value proposition, including healthcare outcomes, be. We worked diligently with our physician partners to understand where advances in their specialties are, especially with Goodman Campbell Brain and Spine related to the future of neuroscience and brain and spine care. And for us, the project, which has been over 2 years in the making, allows us to drive forward that evolution of delivery of more critical care-based services inpatient while transforming more of care to the ambulatory and outpatient setting with our physician partners to show patients what can be done in the home, what can be done in an outpatient setting that traditionally was done in the hospital that doesn't need to be done in there anymore.
Jonathan, I only have 10 seconds, but I know construction is going to begin soon. When would you anticipate, at what point, everything on the drawing board is complete?
We're going to begin construction of the parking areas within the next 2 months. After that, we'll start on women's and NICU, and then our brain and spine hospital will commence at the end of the summer.
All right, Jonathan Nalli, CEO at Ascension St. Vincent here in Indianapolis. Major project on the way for the north side of Indianapolis, and really also one impacting the entire state of Indiana. Jonathan, thanks for joining us.
Thanks, Gary.
All right.